The United Republic of Cameroon is a country located in sub-Saharan Africa with a land area of approximately 183,000 square miles. The country is home to a diverse population of over 20 million people. Since gaining independence from France in 1960, the country has been politically stable as compared to its neighbors. Cameroon has the makings for a solid economy with oil reserves and favorable agricultural conditions, but due to problems such as corruption and unequal income distribution, the economy has underperformed. Cameroon also faces a number of social issues, including low literacy rates, AIDS, and high maternal/infant mortality rates. Children in sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in developed nations.
Infant mortality rate is the major problem that the Cameroon Cradle Club will focus on. The infant mortality ranks 31st highest at 55.1 deaths per 1,000 live births. Through education and family planning, midwife training, and infrastructural improvements, we seek to help progress Cameroon out of the developing stage. It is our goal to decrease infant mortality rates in Cameroon to 25 per 1,000 live births within 15 years. We have discovered 3 partnerships that we could make in order to accomplish our goal. First, we will partner with an organization called Midwife International, which focuses on midwife education in order to increase the chances of healthy deliveries in developing countries. Next, we will work with the U.S. Agency for International Development, which concentrates on road development in rural areas, vital towards our goal of making health care more available. Lastly, we could partner with the United Nations Foundation, focusing on family planning. Working with these 3 organizations will help us to accomplish our goals and eventually make Cameroon a better place.
One way to combat death at childbirth is to enact an educational program for midwives. The total fertility rate of Cameroon is 4.82 children born per woman, showing a great need for qualified physicians or midwives that can help with the birthing process. This one factor can be changed by the education of midwives and can allow people to get the care they need without the need to travel into major cities. Our group will use the money graded to set up 5 schools around the country, facilitating the spread of graduated students throughout the country. The schools will be established in already existing educational institutions, thus preventing the need to spend extra money for unnecessary construction. This project will total 2,000 students through the first 4 years. It will also cover the cost of teachers who are already trained in another country and imported, renting the classrooms from the pre-existing schools, and the cost of the textbooks for the students. The greatest risk to this operation is the large diversity of Cameroon. About 24 different African languages are spoken in Cameroon, with English and French being the main languages learned. The best way to combat this is to get bilingual textbooks and teachers. If not, then at least have some teachers who can speak either language and some textbooks written in either language.
One of our objectives to reducing the infant mortality rate is to provide family planning initiatives. These initiatives will be set in place in order for the people of Cameroon to reduce the adolescent fertility rate, which is currently at 113 births per 1,000 births. Birthing children as an adolescent results in many developmental setbacks for the infant. The Family Planning Initiative will also seek to incorporate the use of contraceptives in order to prevent the spreading of STDs such as HIV. The establishment of pregnancy centers in villages is necessary as our professionals will provide vaccines, treatment, medicine, and access to information. The risk to this initiative is changing views that women must bear children at young ages, and the effectiveness of contraceptives depends if people choose to use them.
The final component will be infrastructural improvements through the paving of roads within a 20-mile radius of the major city of Douala. Another smaller part of this component will be the creation of small healthcare clinics in the surrounding villages. This will allow doctors to travel to the villages to treat the most basic pediatric health problems. According to the World Factbook, Cameroon had 4,100 kilometers of paved road and 47,000 kilometers of unpaved road in 2014. The people living in the less urban areas of Cameroon, spanning out from the city of Douala, need to have safer roads to travel on to reach the main health centers in order to minimize the trade-off of safety versus access to care. According to Stat Compiler, only 53% of infants had the necessary vaccines given to them in 2014. The ability to provide these vaccines is often dependent on the ability to keep them cold and sterile, and this is often difficult with current road conditions. One challenge would be deforestation in the natural areas surrounding Douala. This would be due to construction on the road and having to cut down the trees in the natural areas to make way for new pavement. To mitigate this challenge, the work will be more focused on fixing and maintaining the roads already currently built, rather than cutting down trees to pave entirely new road.
An outcome indicator would be decreased infant mortality rate overall due to the actions of all of our implementations. Also observable will be a decreased spreading of HIV/AIDS due to increased contraceptive use. In addition, we will see lower percentages of children being treated in hospitals as more of the care will be provided at home by midwives.
We will have $20 billion in total. We will allot 50% of our funds towards infrastructural improvements. This is because it will not be cheap moving building materials for the individual health centers in each village. There will also be high labor costs, as all of the villages will have health centers constructed. In addition, the cost to keep the construction sustainable and maintain a light carbon footprint will be high. Midwifery education will receive 35% of the funds. This is due to the high cost of outsourcing professionals who will be able to offer a quality education in the midwife schools. It will also cost extra to hire bilingual professionals to bridge the language barrier between the students.